My name is Julie, and before I started with Injury to Victory, I had a lot of pain. I was heavier, and my mom had passed fairly recently, and I had just COVID hit, and then all the other stuff that happened after COVID just put me into a tailspin. And so I really just became more and more sedentary, and my job is care provider and these days, and so that's very little, walking or anything like that. I had a lot of pain in my knees. I had an Achilles that during a drive to my daughter's, I'm a grandmother now, so during a drive to her shower, the Achilles just flared, and they have a new house with lots of stairs, and I just couldn't take the stairs. I hid it from everybody, but it was everything I could do to get up those stairs. The muscles were weak, the joints were weak, my Achilles killed me going up the stairs. It was just awful. My quality of life, I thought it was okay, but I was making choices about, okay, where am I going to get a parking place? My daughter wanted me to maybe take care of my granddaughter, and also if I moved closer, I wanted to be able to keep up with her, and I wasn't even able to keep up with them, or people my age, it was slower, and it was becoming a real issue, plus the pain just standing. I was taking a lot of meds. I was really supposed to take anything other than Tylenol, but I was taking aspirin, I was taking all the NSAIDs, really, when I should only be taking Tylenol. And that I haven't done for months now. Hardly any, maybe just once. Yeah, I was trying to do things on my own. My clients had physical therapy. I talked with the physical therapist, about my issues sometimes when we just were talking. And I did a lot of stretching because I thought stretching was the answer. and I have a stationary bike, so I was doing that. I was trying to walk, There's so many positive things. My knees really right now are not painful really at all. I might feel them, but that's it, and my Achilles is good. It's a little tight at times, but my Achilles, which has been, just horrible for over probably coming up on 2 years, is so much better. Every time I sit in something really low, I'm just amazed that I can do it under control and without any pain, We went to our favorite place on the ocean, and we were there and did all of our favorite things. And I asked if we could go to do some tide pooling. And I have been there before and just sort of stood back and watched everyone else do the tide pooling part because it's uneven, it's rocks, it's stepping up, it's stepping down. And I was able to do that after we'd been there for 6 or 7 hours, So we had a really wonderful day, and that was a lot of walking, a lot of hiking, a lot of climbing over stuff, and a couple of times just stepping down off of a big rock with my knee bending. Now I did feel that. But I didn't kill me, and it wasn't sore after, so it's a pretty nice day, thanks to Injury to Victory. To have lost the weight when we weren't really focusing on that. The focus has been to get my knees to feel better, my Achilles to feel better, to get the inflammation down, and my body tends to have quite a lot of inflammation. And the side effect is that I've lost almost officially 50 pounds, not quite. Unofficially, I bet it's close to 60 or more pounds. What makes this different for me is the accountability, I think, and also the contact, fairly instant feedback, not really instant, but, soon enough, within the same day or a couple of days probably, about how I'm doing or whether I'm doing it correctly or how I'm feeling or, the nutrition support. I knew I needed that because I needed it before, so I went ahead and did the nutritional support and the logging. So while a lot of people may not like logging, I needed it and I knew I needed it. And because of it, I have lost 50 pounds. So besides the nutrition and the logging and the feedback for that, then the exercise program, I really like that it's tailored to me or that the specialist, he sort of knows or finds out what I can do and can't do, or what's more difficult or okay, that's not working, or and changes it up. So let's try this one. And it's more curated to what I could do at the time. And so consequently, I was able to work through some issues, especially when I started to have like a flare up. It's like, okay, let's not do that, or let's change it and do this. And I didn't even notice it really. Sometimes it's just this, okay, let's try this routine. And I realized that routine was giving, a rest to my knee or to my Achilles or whatever. And then all of a sudden there's no pain. Like right now, there's very, very little pain, just the tightness in my Achilles, and it's quite wonderful. And it's noticeable. All of a sudden I notice, okay, nothing hurts. And then for me, I don't think I've ever, to get back to the question, worked out like I work out now. So I mean, I committed to this. I wanted to do it. And I've spent, what was that? What did I join? Curves. I joined Curves. I swear, I paid for Curves for years. I mean, I know, okay, that dates me, but oh well. And Jazzercise before that, I've done all that, but I didn't really commit to those like I've committed to this. And I think it's the support that I get and the feedback. And I never thought that I would be able to do this video here. I never thought that I would be able to show a video of myself doing exercises. I did that. I've sent them to the specialist so that they can see whether or not I'm doing it well, or if and surprisingly, a couple of times I said that was perfect. So I thought that was pretty cool. The anti-inflammatory lifestyle, that's the other thing that I didn't really understand as much when I first was looking at Instagram, that it was a holistic approach. I mean, I know that the specialist said that it was, but I wasn't, I guess, paying attention to that. It was sort of in the background, and I was dabbling with that. But the changes in the eating and the things that I thought I was doing okay, I was drinking mostly water. I wasn't drinking soda, but I was also eating a lot of tomatoes. I mean, practically every meal. Or every day at least, because I love them. But I really restricted those the last few months, and it's not like I had to give them up. I just don't eat them like I used to, and also things that were more that I've discovered were more inflammatory. I've tried to reduce the amounts that I eat and drink, things like that. And the water, holy cow! Oh, I forgot my water. Lots and lots of water, which is really, I think, impressive the way it makes me feel. And I didn't think I was dehydrated before, but I must have been. Absolutely. I absolutely would recommend it. I have recommended it. I've recommended it to strangers. I've shown people on the street. I quite like that, but practically, and I absolutely recommend it because the support and techniques and the different exercises, they've just really worked wonderful for me. And while I am far from the end of my journey, I didn't think that I could look and feel the way I do at the moment. And while I do feel, I'm not young, I do feel like I'm aging backwards, like they say in And I recommend it to anybody that's you might not be able over 300 pounds, which I was. I never told anybody that, but I was. And I was over 300 pounds and stopped weighing myself. So that's how come I don't know unofficially how much I was. But yeah, when I couldn't get up my daughter's steps, when I wanted to be around my granddaughter, I needed something, and Injury to Victory was on my feed, and I jumped. And I would do it again. And I tell anybody that wants to hear that I would.